Hello, this is Aaron Shoemaker, and I'm here with your regular Ascension Medical Group update. Today we want to talk to you about screening and billing opportunities. This is No Shave November, which is meant to be more screening and less shaving. So today we want to talk about a few priority screening events we can do for our patients, as well as potentially bill those and be compliant documentation for those. So the first I want to mention to you is the smoking cessation counseling. This is something where 20% of all of our patients have tobacco abuse. We know that it's really out there and significant, and it's also something that our payers will pay us to counsel our patients for. All payers will cover this in general, and so because of those two things, we've said we can make a difference for our patients if we work on smoking cessation. The group with Linda Gates and compliance have gone through and worked with our Athena team and Stacy White and Colleen Root to come up with an easy workflow to document this, to get the best outcome for our patients and make sure that we are compliant in our documentation for billing as well, and making it easy for you as providers. There was a webinar that was done for the group. It lasts 45 minutes to an hour, and it's something that I would encourage you to look at in order to optimize the care for our patients. The second, and also in the same webinar, we discussed lung cancer CT screening. This is for patients who've had 30-pack years of smoking and have smoked in the last 15 years, and they're under 77 years of age. For those people, we actually have the ability to counsel them and get paid for counseling them for potential lung cancer screening. This is something that we in the medical group would really like to see as something like colonoscopy or mammography. It's a recommended screening measure. We know that when we do this for patients and we find cancers, they're in stage 1 or stage 2 instead of stage 4 when they're found when they have symptoms. So we can make a difference for our patients by counseling them on lung cancer screening with CT. And we'd love for you to look at the link that talks about how to do this at length. Thirdly, there's been a webinar on depression screening. Again, something we'd really like to look at as just part of our standard screening package. It's recommended that all people 12 years of age and up have depression screening on an annual basis. We know that all the things that we treat have worse outcomes in patients who have comorbid depression. So it's the right thing to do for our patients to really be analytical on how we do this on a regular basis. So we've provided another webinar that's separate on this, where you can learn how to use the PHQ-2 and PHQ-9 within the practice. And we've also started to look at implementing Freesia as an alternative for all patients to be screened once a year for depression. And that's something that you'll see go live over the next few months. This is one where Medicare covers and not all payers do cover. So we want you to be aware of the compliance and billing opportunities that are involved there. And this is in the webinar that'll be linked to the bottom. Lastly, we are including links to each of these webinars on the bottom of the email that you received today. I'd encourage you to watch those. This is, again, No Shave November. So let's screen more and shave less, and focus on men's health this month, as well as all of our screening opportunities for all of our patients to optimize the outcomes of all those who grant us the favor of seeing us as their providers. Thank you.